Namaste and welcome to the Federal. Uh, in our continuation coverage of the COVID-19 corona virus, today we are going to have a very interesting discussion with Professor Gautam Menon, who will be joining us from Ashoka University. And we are going to be talking about the mathematics of the epidemic. Uh, welcome to our show, Professor Gautam Menon. Thank you so
Thank you.
much for joining us.
Thank you very
Uh,
much for inviting me.
yeah. So straight away to the question: Do people naturally understand this whole exponential curve business? We keep hearing that the disease is spreading exponentially. Could you please, explain what this whole significance of this exponentiality as far as this disease
Yes.
is concerned?
Yes, that's easy to do. If you remember this old story of the king and the courtier, and the king wanted to give the courtier some payment for all the services he had rendered. And the courtier said, just give me one, take a chessboard, take one grain of rice and put it on the first square, two on the second square, four on the third square, eight on the fourth square, and so on and so forth. So we have the sequence 1, 2, 4, 8, 16, 32, 64. And he said, that's all I need. Now, the thing, this is a series. If you add this number up, that is a number that actually grows surprisingly fast. And it's soon, by the time you get to the 64th square of the chessboard, as the king discovered, there is not enough rice in the world to be able to give to the courtier. That's what you mean by exponential growth. It may appear to start off slowly in the beginning. 1, 2, 4, 8 don't look like big numbers, but it can rapidly become very fast. The analogy with the disease is if you have a disease in which one person who is infected infects two people, then one becomes two infected, becomes four infected because the two people can themselves infect two more people in turn. And they can go on to infect two more people in turn. So you can see the sequence 1, 2, 4, 8, 16, etc. That is exactly the same sequence as you have in the other example of the chessboard. That's what you mean by exponential growth, the fact that the numbers of people infected can suddenly grow very large. And that is, we understand diseases from that point of view in terms of the number of people that one infected person can potentially infect. In fact, that term is so important that it has its own name. It's called the basic reproductive ratio. And each disease carries with it a certain reproductive ratio. The number for COVID is around 2.5. The number for measles is very large, it's around 18. So measles spreads very fast through a population. COVID is still less, it's still sort of controllable number, but nevertheless, it also exhibits the same exponential growth that you would expect of a disease that is spreading through a population. That is called an epidemic.
So by a reproductive rate of 2.5, what we essentially mean is every person who catches this disease is going to infect 2.5 people. Is that what,
On average, that
on
is
an
correct.
average?
On average.
Right? All right. Now, coming to another issue about which we're facing now is about testing, right? They're saying that from a data point of view, we have been reporting considerably very low number of cases. There are different theories. One talk about the heat, probably people, there are different theories which circulate. But according to you, how would you view data on testing, and how important is that data when compared to the number of confirmed cases?
So the point of view that the government is taking currently is that all the cases are those that the government has accounted for in terms of actually catching people at the point where they enter India from COVID affected countries, making sure that they are quarantined, that they're tested, that they're allowed to recover. I mean, that they can recover over a 14 to 21 day period, which is the quarantining period, and that we need not worry about any cases at all apart from these. The concern that people who work in public health, epidemiologists, and so on have is that there are often cases that you miss through screening, people who don't show symptoms, who may just have escaped the screening procedure that are in the airport. So they leave the airport, or who may have even come into India before the procedure started. The issue there is these people will now enter the community and they will start off cases on their own. People may interpret this as a cold. In most cases, in 80% of the cases, the COVID virus, the COVID-19 disease manifests like a bad cold, like a mild flu, and people don't think much about it. It's only in a smaller fraction of the cases that it progresses to something more serious. But the question is, can we detect that? Are we actually seeing that in the population? Because we are not testing for it. There is very little community-based testing that has been done so far. For a long period, we didn't do it. Now we are slowly doing it, but the numbers are very small. And for people like me, that's a central issue. To what extent is there community transmission of COVID-19 that we just are not able to see because we are not testing adequately for it.
Another question, which was I mean, definitely interested in knowing about the mathematics of this, is what has been suggested by, or at least was discussed in the United Kingdom about how about infecting a large population, and checking out those people who are going to have immunity, they're going to get away with it, and thereby we'll be able to concentrate on uh, people who are affected most. Do you think something like that? I mean, intuitively, does that make sense? Is
So
that,
that that
I
is
mean, if you could
certainly
explain about
yes,
the
that's
herd
it's
immunity.
well established, and it's related to this reproductive ratio. That from the reproductive ratio, you can figure out what is a fraction of the population that you need to immunize or should have caught the disease and recovered, so that they then become immune to the disease, in order to protect those who have not been affected by the disease. So, in the case of COVID-19, the number is around 60%, let us say, because that is the sort of number that the British have been using. Had it been a disease that did not have fatal consequences for around 2% of the population, that would have been a fine argument because people would fall ill, but they would then recover. However, here, if you look at the numbers, if you look at 2% of 60% of the UK population,
That's
that is actually an extremely large number. And I think it was not appreciated that this number was actually so large and that the UK health system would not be able to cope in terms of hospital beds, ICU beds, ventilators, and other health infrastructure, given these sorts of numbers. The other point that people have raised is that we don't really know to what extent having the COVID-19 infection once protects you against a later infection. It's possible that it might not. There may be no lifelong immunity. The immunity may last for a few months, maybe a year, but maybe not longer than that. We just don't know enough about the disease at this point. So, if you say that even if we took this extreme step, assuming that some people will die in order to protect other people, there is no guarantee that the reason you have done it is a valid reason because at this stage we don't know enough. So I think the UK government is now backtracking on that argument. As I said, it's not an unreasonable argument that it is true that having some fraction of the population get the disease protects other people who have not got it yet. The only reason is that it is much easier applied to a disease whose consequences are milder and not to a disease whose consequences can be fatal for about 2% of the population.
Professor Gautam, as somebody who does modeling of infectious disease and its implication for public policy, could you explain a bit more about what exactly is that? What do you model in terms of these various infectious diseases, and what sort of policy intervention would such analysis help our policymakers, especially in the current context?
So people who work on the mathematical modeling of diseases typically have one particular disease in mind. They know some of the details behind the disease, how it spreads from person to person, is close physical contact required, or can it be more? Is it a water transmissible disease? Is it borne by some vector like a mosquito and so on? They know these facts, and they construct mathematical models that describe the progression of the disease in the population. These models contain parameters that you can tune depending upon what interventions you might apply. For example, for the coronavirus, if it is transmitted, as we understand, through close contact between people, through the respiratory route, then introducing social distancing, not allowing people to get too close to each other or too close to infected people, reduces the probability that you will transfer the disease from one person to the other. That is an important consideration. That's where modeling comes in. As you can really assess the merits of many different types of interventions using mathematical models and say this will work better than that. The combination of this intervention and this intervention will work the best. Shutting down schools will have this outcome. It may reduce. You will still have the disease, but you may spread it out over a longer period of time. These are all positives that actually come in when you think about models and how to apply models to thinking about public policy. Models can actually help you understand public policy better in terms of deciding which route is the best route to take. And then you can add economic models on top of that to say what are the economic consequences of this action, or this action. You can compare quarantining with social distancing, with shutting down schools, with shutting down malls and other places where people congregate, of limiting the sizes of people who can group together at any particular time. So for all of this, there is no other better way that we know than to have nice mathematics.
Break. We have been talking with Professor Gautam Menon, and we will be asking him more about what this epi curve is, what does get represented in this epi curve, and what can someone deduce from an epi curve on these? Professor Gautam?
Yeah.
Yeah. So if you could just talk a bit, I'm sorry about the patchy connection, my apologies. So just to understand, if you could just briefly talk about the epidemic curve and why the epidemic curve is an important guide, especially for people like you who are going to assess decision control with public health or policy based on data.
So the issue with the epidemic curve is the question of how does the number of cases of infected people rise to a maximum and then come down. Ideally, what you would like to do is to push that number as close to zero as possible and prevent its rise to a large number. The larger the curve rises, the more the number of people who are going to be infected. These curves all have a fairly standard shape. They start off, they grow exponentially, they peak, and then they have a long tail when the number of cases declines. The issue with flattening that curve, so the peak of that is the maximum number of people who are infected. These are the people who will throng your hospitals and your public health centers, and you have to make sure that your system is able to deal with that. In practically dealing with the effects of an infectious disease, you want to push that maximum number as low as possible because that is the limit to how many you can handle is set by the limitations of your public health system. So that's what they mean by pushing the curve down or flattening the curve. Just try to reduce the maximum number of people who are infected and therefore will require.
Uh, I'm afraid the connection is, I've again lost the audio bit. Our apologies. Yeah, so sorry, we seem to be having a patchy connection here. We will probably check back at our end and revert. We were having a very interesting discussion on the epidemic curve and the epi curve. We apologize for this technical glitch and promise you come back. Please continue watching and following the Federal.com for our latest updates on the coronavirus and the COVID-19 situation. Thank you and namaste.